Hello, we are going to talk about Chapter 9, which is venipuncture. Oh, I always skip that first objective. So we're going to talk about the various steps in performing venipuncture, procedures and techniques for more difficult veins, and then some complications that may arise. So venipuncture, of course, is the most common technique for obtaining blood specimens. We have our basic steps that we need to make sure we take, and we've talked about these before, but I'm going to review them quickly. We always want to greet the patient and properly identify them with at least 2 patient identifiers. We want to select and assemble all of our equipment. We want to make sure that we're using aseptic technique and standard precautions during the whole process. We want to provide proper post-procedure patient care, which includes things like applying pressure and making sure the bleeding has stopped. We want to make sure that we properly label our specimens, and we correctly handle and transport the specimens to the lab. And again, this is review as well, but venipuncture equipment, we want to make sure that after we have greeted the patient and properly identified them, before we actually begin the venipuncture, we take all from the supplies that we brought with us, we make sure to set it up in a way that works best for us. This is going to include our gloves, tourniquet, the alcohol prep pads, gauze pads, the needles, tubes, sharps containers, bandages or tape, something to mark the labels with, and then the biohazard bag for transport. You want to make sure that you place that phlebotomy cart or tray within reach of you, just in case you do need to reach and get something. You don't want to have to be reaching over in an awkward way. Make sure it's in a place that's accessible to you. In addition, you want to get your system all set up and have that first tube kind of ready to go, loosely sitting in that connector, the hub, sorry. So the first thing we're going to do after we get ourselves all set up is going to make sure that the patient is positioned appropriately. When we position the patient, we want to realize that there are going to be some differences. Of course, if we're in the inpatient setting, most of the patients in inpatient are going to be lying down in the bed. They might be slightly elevated their head of bed, and that's okay. But you do want to make sure raise that bed to a safe working level for you to protect you and your back, and also be comfortable yourself. Because not only does the patient need to be in a comfortable and supported, stable position, but you do as well. Outpatients are typically sitting in a specialized kind of phlebotomy chair. It's got the arms on both sides that can move to go to whichever side you're going to end up doing your venipuncture on. If a patient is prone to fainting, they already know that, it's better to have them in a reclined position, whether that be a reclining chair or lying down in the bed. Whatever arm you end up using, make sure that that arm is fully supported and stable. You can sometimes add some stability and support by rolling up a pillow or a towel and putting it under the arm a little bit. It's also not a bad idea to slightly hyperextend the elbow, because that can actually help you to locate the vein. All right, so we've got applying the tourniquet. So tourniquets, of course, help to make the vein a little more visible and palpable. And it does that by slowing down the circulation in those veins, or the blood flow in those veins. You really should be feeling your veins or choosing your veins based on palpation, not necessarily sight. Sometimes it actually is really beneficial when you're feeling and palpating for a vein to close your eyes, because it actually heightens the sense of touch. Veins that are appropriate should feel bounce. You should have some bounce and resilience to them. If they're thick and cord-like, that's not a good choice. The tourniquet, when we're applying the tourniquet, I got a little ahead of myself there. You want to apply that tourniquet about 3 to 4 inches above the venipuncture site. Ensure that it's flat against the skin. You don't want the tourniquet all twisted and bunched up or anything. And something to keep in mind is when you're working with the elderly or somebody with fragile skin, you want to do the tourniquet over a shirt sleeve or a gown sleeve so that you don't tear or injure their skin. And it's always really important to remember not to leave that tourniquet on for any longer than 1 minute or 60 seconds. So when we've got our tourniquet on now, it's important that you have the patient's arm angled in the downward position, and you can ask them to make a fist. Now, someone that doesn't know any better might ask the patient to pump the fist. You do not want to ever have the patient pump the fist. That can actually cause alterations in the specimen results. You can have them squeeze their fist and hold it, and that's going to be really helpful actually. So arm angle down, squeeze the fist. Our first choice is always going to be at the antecubital fossa. The median cubital vein is usually the best choice, but you do want to examine both arms and all veins that you can see and palpate and pick the best one. A little tip is that patients tend to have more prominent veins on their dominant arm. When we're palpating the vein, we're checking for size, depth, and the direction in which the vein is going so that we know which angle to go in with our needle. Sometimes you might use those warming cloths or tissue warmers to help increase blood flow and vein size. But like I mentioned a second ago, you want to select the vein that has good bounce and resilience, not hard or cord-like. Once you have located the vein you want to use, you're going to remove that tourniquet and let that patient relax their fist. There's a few things that you don't want to do when you're selecting the vein site. You don't want to use veins of the lower extremities. You don't want to use an arm that's swollen. You also don't want to use an arm where there's been a mastectomy. That's when there's been removal of the breast. And yes, people have double mastectomies. So a physician should have approved which side to do the venipuncture on before you do that. Sometimes after it's been 5 years after the mastectomy, you can use that side, but again, make sure that it's been approved by the physician. You never want to stick an arm that has a fistula that's being used for dialysis. And I don't mean if it's being used at the moment. I mean, if they have a fistula, don't use that arm. And finally, when we have patients with IVs, which we have a lot if we're inpatient, you want to try to avoid the arm that has IV access. Not always possible. Some patients have multiple IVs. So if you do need to use an arm with an IV site, you want to use, or stick the arm below the site of the IV. And if they have fluid running, you want to make sure that nurse cut those fluids off for at least 2 minutes prior to the blood draw, because again, that can cause alterations in our specimen results. Okay, so we have got our patient set up, we have our patient positioned, we've found our venipuncture, the vein that we want to use for venipuncture, and now we're ready to actually get the specimen. So we're going to first clean the site with alcohol, and we've talked about how to do that in those concentric circles getting bigger and bigger. We want to ensure that that alcohol is dried completely and then reapply that tourniquet. So again, our supplies should already be in reach and ready to go. When you have that patient reapply, or when you reapply that tourniquet, you can again ask that patient to make the fist, but do not pump. You want to use your non-dominant hand to anchor that vein and hold all of your collection equipment and devices in your dominant hand. It's at this point and not before that you remove the needle cover and do a quick visual inspection of that needle to make sure there are no burrs or anything wrong with the tip of that needle. If there is, dispose and get a new one. Once you've checked that needle, you're going to position it just above the insertion site, making sure that the bevel is up. We insert the needle at a 15 to 30 degree angle in a steady motion. Veins that are lying closer to the surface, that's when you're going to be more at that 15 degree angle. Veins that are deeper, you're going to be more at that 30 degree angle. So that's again why we're palpating the veins, to learn about size and depth and direction. Once that needle is in the arm and hopefully in the vein, right, we're going to use our thumb to push that evacuated tube completely into the tube holder, at which point we're expecting blood to start to flow into the tube. As soon as we see that blood beginning to flow into the tube, you can reach up with your hand and release that tourniquet and tell the patient they're welcome to relax that hand. Of course, the whole time you're letting those tubes fill, whether you're doing one or multiple, you're holding that needle and your collection equipment steady. You don't want to tip it or go in any other direction. Hold it steady. It's important to remember to fill the tubes completely. Remember, they're vacuum tubes, so they're going to fill to their fill line and not further. So make sure that they fill completely, remove and invert those tubes immediately, and do it in the order of draw, which you learned about in your last lecture. And again, the order of draw and the different tube colors additives, and the additive actions are all things that you're going to need to memorize. So when you're ready to remove the needle, basically you're going to reach over and grab your 2x2 gauze and get it folded into 4s. And then you're going to hold it directly over the venipuncture site. Don't apply pressure onto that site yet. You're going to remove, this kind of happens simultaneously. You're going to remove the needle, engage the safety feature, and apply gentle pressure with that gauze. Again, don't apply pressure and pull the needle at the same time. It's going to be painful and uncomfortable for your patient. At this point, it's appropriate to ask the patient to hold pressure while you're finishing up your other things, unless for some reason they can't, and then you'll need to do it. But you're going to have the patient hold pressure on that gauze for 3 to 5 minutes without bending the arm. All right, so now you've just taken the needle out, engaged the safety, and you have the patient holding pressure. Now you want to discard that sharp immediately to get that out of the way. And usually when we say discard that sharp, that includes the attached collection equipment as well. So the hub, whatever is part of it. You're going to then label your specimens. Remember, we've said this before, you never label a specimen before you do the draw, and you always label the specimen before you leave the blood collection area or the patient's room. You want to make sure to observe for any handling instructions special to the blood specimen, and we'll talk more about that in later lectures. Then when you're done labeling, putting in your transport bag, you want to ensure that the bleeding has stopped. Apply whichever adhesive bandage or gauze or wrap is appropriate for your patient. Clean up any remaining supplies, thank the patient, wash your hands, and go on to deliver the specimen to the lab. Sorry, I realize that's a little bit covered up with me in the corner, but that says venipuncture with winged infusion or butterfly. Most of the steps are the same that we just went over. There's just a couple of differences in equipment, for example. So butterfly or winged infusion sets are used on patients with very small or difficult to access veins. They're also generally less painful, good for kids. You can use butterfly sets like we've talked about before with either the evacuated tubes or a syringe with the plunger. Once the needle is inserted to the vein, again, just like we did with the venipuncture we just were talking about, but with the needle butterfly sets, you're going to see a flash of blood in the needle hub. And then you get to know, oh, I did get that vein before you go pushing the tube. So after you know you're in the vein, whether it be the syringe or the evacuated tubes directly, you're going to collect your samples, letting them fill completely and going in the correct order of draw. After you remove the needle from the arm, if you used the syringe method, you're going to transfer the blood that you just have collected in that syringe directly to the evacuated tubes using one of our transfer hubs. So there are some complications that can come around with venipuncture, okay? Let me flip to my notes here. So, and these are some of them here, and I'm just going to touch briefly on some of these. Oh, and what I wanted to mention too, let me back up 1 second because I wanted to mention, whenever you're using a syringe, whether it be the butterfly needle with a syringe or the hypodermic needle with a syringe, when you're transferring into an evacuated tube, never push on the plunger. Let the vacuum tube do its job. If you push on the plunger, you're going to cause hemolysis and breakdown of the red blood cells. So just keep that in mind. All right, so documentation is going to be essential if we have any of these venipuncture complications, not only so that we can make sure the patient's okay in the minutes, hours, or days to follow, but also to learn from mistakes or learn from things that happen so we can make them better in the future for phlebotomists and for our patients. So fainting or syncope sometimes happens. What you want to just be looking for, again, first of all, if you know someone is prone to fainting, be prepared for that, have them in the proper position, be ready to help support them if they do slump forward or something, if they happen to be well, hopefully they're in a reclining chair. But if it's someone who you don't know is going to faint and you notice that they're starting to get pale and sweaty, they might be breathing either faster than normal or a little slower than normal, and then they pass out. What we want to do is we need to worry about their safety, right? So if someone passes out, you're going to remove that needle, take the tourniquet, and apply pressure right away. While you're doing all that, you're also going to be making sure that they're not going to fall off of a bed or a chair, and you're going to call for help. The main thing too, anytime any of these complications happens, is do not leave the patient. Let's see. Oh, I didn't need to go forward. I'm sorry. So seizures and the nausea and vomiting. There's sometimes that happens when patients have fainting episodes or seizures. So seizures, it is rare that this happens during phlebotomy, but it's not impossible. Again, just like with the fainting, if someone begins to seize, you want to get that needle out, tourniquet off, and apply pressure right away, while still not restricting the patient, because you never want to restrict a seizing patient. You want to let their body move, but you still need to apply pressure. And then again, when someone's seizing, the most important thing is to protect them from injury, especially their head. So if you can lie them flat on the floor, maybe put pillows underneath or around their head, that's ideal, and call for help and do not leave the patient. Petechia, that picture on the bottom corner there is petechia. These are small, non-raised red spots on the skin, and this is due to little minute hemorrhages. This can happen if a tourniquet is left on for too long. So basically, we can prevent this from even happening by never leaving those tourniquets on for longer than a minute. Hematoma, this is a mass of blood, basically. It's a lot of blood that has leaked into the tissues. This can happen for a couple reasons. Either you removed the needle but never took that tourniquet off, so now you've got that extra pressure pushing that blood through that puncture site or to that puncture site and around it, causing the hematoma right there. Another reason is if you went too far and you went through the vein, then a hematoma can happen then as well. So when you see a hematoma starting to develop, you're going to want to remove the needle, remove the tourniquet if you hadn't already, and apply pressure. Sometimes this can be uncomfortable for patients, and giving them like a nice pack or a cool pack is also really helpful. I don't know why I'm doing that. Let's see. There is something called iatrogenic, I don't think that's on here, but I'm gonna tell you about it anyway. Iatrogenic anemia. This happens when you have a patient who has repeated blood collections over a period of time, and it's a type of anemia that develops as related to this numerous blood collection over time. If the amount of blood removed from anybody's body, whether it be over time or at one moment, is greater than 10% of their total blood volume, they could suffer from a life-threatening condition called exsanguination. Something to really keep in mind, especially if you're taking blood, either a large amount or repeated blood samples from patients who are smaller, infants or children. All right, a couple more here that I wanted to mention. So infection. There's a couple ways that we can get infection when related to venipuncture. One is that if the venipuncture site, like if you're doing a heel stick and you puncture the bone on accident, now that's gonna be more with the dermal, but I thought of that when we're talking about infection here, that can cause osteomyelitis. If you didn't clean the puncture site appropriately before you did it, if your equipment was not sterile, so you cleaned and then you touched, or you opened your needle cap. I'm sorry, I literally just swallowed a bug. It flew right into my mouth. I think I coughed it up. So, all right, lost my train of thought. So this is a reason to not remove the cap from the needle until you are literally ready to use it, because you don't want to risk it becoming unsterile. Injury, this has to do when you don't choose the venipuncture site appropriately or properly. You chose a vein that was really tight or cord-like, and maybe it's actually a tendon, or you were digging or probing around, which we should never do, and you hit a nerve and caused some nerve damage. If you hit a nerve, what you're going to get is someone jerking and feeling the shocking sensation. If that happens, of course, remove the needle, the tourniquet. You want to apply pressure, but also have the patient raise their arm and keep it elevated, and go get some ice for them as well. Additive reflux, that's the last one, I swear. I'm going to move on. This is what happens when blood that has gone into the tube and mixed with the additives in the tube backflows. Easy to prevent this. The way to prevent this is to make sure to keep the venipuncture site down below the heart, so the arm angled down towards the ground. All right. So troubleshooting unsuccessful venipunctures. It happens, right? There's a few reasons why it might happen. Basically, hold on, let me make sure. Okay, no, we're good. It can happen for a few reasons. Either that tube has insufficient vacuum, it's a bad tube, it's expired, whatever it might be. We always keep an extra tube. Like if I'm drawing a certain type of tube, I'm going to keep maybe 1 or 2 extra of them with me and nearby so that if I do need to use it, I can grab it easily. If the needle isn't inserted far enough, that might be why as well. It's okay to advance the needle a bit further if you think that's appropriate. Or the needle is against the wall or it's gone through the vein completely. In those cases, it is okay to pull back slightly. Pulling back or advancing slightly is not the same thing as digging or probing, which, like I said, is never okay. Another option is that possibility is that the vein has collapsed. Veins don't roll, despite what you've heard or despite what patients will tell you when they say my veins roll. It just means they need to be anchored properly, or maybe they have collapsed if it's happened while you're attempting venipuncture. Sometimes veins collapse because the vacuum is too strong. So it's putting too much pressure on that vein, causing the walls to collapse against each other, or the tourniquet is too tight or too close to the site at which you're attempting the venipuncture. Some situations that affect the quality of the specimen, which I don't have a slide on, but I was going to mention as well. Accidental arterial puncture. So if you accidentally puncture an artery, again, before we even get to that point, we should be pretty good at knowing what is the difference between peeling or palpating an artery and a vein. Remember, an artery is going to pulsate, right? And it's going to be more firmer than a vein because it's got those thicker muscular walls. So it's going to be firmer and it's going to pulsate. And if you do puncture the artery, you might even see that pulsating blood coming into the tube. If you do puncture an artery on accident, you want to remove the tourniquet right away, withdraw the needle, and then apply firm pressure for at least 5 minutes or longer. After these, you're definitely going to want to apply a good snug dressing. Now, we don't want to cut off circulation, but we want it to be applying pressure, so a pressure dressing, and let the nurse know immediately. In addition, make sure that that patient is keeping that arm still. If you happen to use arterial blood and send it to the lab, make sure that it is noted on there that it is arterial, because that is going to change the reference ranges for the specimen results. Another thing that could happen is hemoconcentration. This is a rapid increase in the ratio of blood components to plasma, or another way of saying it is you have a decrease in the fluid content of the blood and an increase in the blood molecule content. This happens when one of two things or both. Either the tourniquet has been left on for longer than a minute, or the patient has been doing the fist pumping. And what that causes is that causes the water to leave the veins, but leaving those molecules and cells and chemicals in the blood in a higher concentration. This can cause, not accurate lab results. So make sure that you're aware of those things as well. And I think that's it. Let us know if you have any questions. Thank you.